So our next guests are, they're revolutionizing the world with the White Ribbon Project. So high school sweethearts since 1979, they were married, and they've been married 36 years. Heidi Nafman-Onda and Dr. Pierre Onda co-founded the White Ribbon Project, which aims to change the public perception of lung cancer and the message, anyone with lungs can get lung cancer and no one deserves it. Heidi is a lifelong health enthusiast, health educator, and fitness trainer with no history of smoking. She was diagnosed with stage 3 inoperable lung cancer in October of 2018. And Pierre is Heidi's caregiver and a recently retired primary care physician. Lung cancer rocked their world like it did all of ours, right? They are fighting back strong and hard by encouraging the lung cancer community to unify, stand tall, and increase lung cancer awareness by becoming visible and vocal and by humanizing this misunderstood disease. Thank you, Heidi and Pierre.
Oh, well, thank you. And thank all of you for coming and attending today. I'm going to try to share our screen. We have a little slideshow, mostly images. So we're just going to pull this up here. As Dusty mentioned, for us, we leaned into lung cancer advocacy as a way to help cope. And we're going to give you a little bit of that story, but we're primarily a grassroots organization. Our goal is to promote awareness, and we'll talk a little bit about some of the things that we focus on, but we're really interested in working with other people who have been affected by lung cancer. Could be a caretaker, could be someone who has the diagnosis, or clinicians. And if they have an interest in lung cancer advocacy, then finding a way to work with them. We're pretty inclusive. Doesn't matter what type of lung cancer you have, doesn't matter what stage. Also, it doesn't matter whether or not you have the diagnosis. Caretakers are welcome.
So this is us. Again, Pierre is a primary care physician that's recently retired, and I have been a lifetime health enthusiast, health educator, and a fitness trainer for pretty much all my life, fitness training for about more than 20 years, and this is our family. And we were blindsided by my stage 3A lung cancer diagnosis in October of 2018. I had no symptoms whatsoever. I had a symptom of a different health issue, and my doctor had ordered a scan and came back with, wow, you have stage 3A inoperable lung cancer. I was given a miserable prognosis. I didn't have any identifiable mutations or anything. And I was told my only treatment option was chemoradiation, and I had about 4 to 6 months to live. I couldn't believe what I was hearing, because I felt fine. It just was so shocking. But when I met, I'm going to go back a second. When I met my oncologist, I was given so much more hope. He had told me that there was a new immunotherapy that had just been FDA approved about a month prior to my diagnosis. And if I didn't show progression after chemoradiation, that I would be able to have this immunotherapy. So I had this for a year, every other week for 12 months, which came out to 26 infusions. And here I am today, 4.5 years later, doing great. So how did this turn into the White Ribbon Project? Well, as I didn't have any sense of the lung cancer community for almost the first year of my diagnosis, and felt very, very alone. And I thought to myself, as a health educator, why do I feel alone? I've learned the #1 cancer killer. No one should feel alone. There's a lot of us out there. And as we were approaching Lung Cancer Awareness Month, we had been approaching our university system here in Colorado for, at least 9 months. And was never getting any true response that they were going to do anything. There seemed to be no plans for Lung Cancer Awareness Month. And when the pandemic came and we were able to meet other advocates across the country, they were running into the same issue. And I thought, wow, I don't have to wait for them to do something. I can do something from my own front yard from my house. I didn't need permission. And my husband had woodworking skills, and I asked him to make me a big white ribbon out of wood that I could put on my front door and at least scream to my community that I had lung cancer. I was not ashamed of this at all, and we need to talk about it. Again, I didn't have to wait. I could do something that was in my control. So you've probably met Chris this morning, and you'll see more of him later. He had a great idea to take this project on the road in the summer of 2021. We were gaining a lot of traction before this, but we wanted to be able to reach out to people across the country and show them how to make ribbons, build the community, get people to come together to make these ribbons, build strong, show them that they are loved and cared about. And we don't need to cave to a stigma that's been created by the media and other institutional messaging. And we can show that, you know, we really care about people, and there's no shame in this diagnosis. Just like any other diagnosis, we need to be respected and have treatment options and know that there is hope. So we spent about 6 weeks on the road from the beginning of July through towards the end of August, and we hit all of these states and cities. There was community organizing going on everywhere. In the upper left corner here, you see Dr. Christine Lovely, and she is in Nashville, and she was able to put together a collaborative build with 4 different hospital systems. It didn't matter where you had your treatment. We wanted everyone to understand that this needs to be an effort that includes everyone. And then in the upper right-hand corner, this is pretty incredible. This was rural Iowa. We don't want to forget people in rural areas. They have lung cancer too. And this was an amazing build event where we had community members approaching local businesses who donated all of the materials. And we had people coming from all over to this small town of Runnels, Iowa, to band together, build community, and show everyone here is loved and cared about. Lower right-hand corner is in Philadelphia, Pennsylvania, at the home of Dr. Jonathan Wettstein. He's a researcher doing a lot of work in lung cancer. And he also reached out to the other hospital systems in Philadelphia. And we had 4 different hospital systems represented as well. And in all of these builds are always survivors and caregivers and people who care, people who want to learn more and get involved. So again, you're going to do some tracing this morning, I understand, and possibly some cutting and see the process. But in the far left side, that's my radiation oncologist at my home, tracing a ribbon. There's Chris and Dr. Ross Camage cutting ribbons together. We have some labeling going on and signing of ribbons here in Kentucky and in North Carolina. If you recognize Tama, she was at a build. It was on World Lung Cancer Day in August of 2021 when we were on our road trip. We made some stops where people didn't really have time to make ribbons. So we came with painted ribbons already to the University of Michigan. And they came out and they're doctors, and we had caregivers and survivors come out to label the ribbons and sign them and then pass them along to people who were newly diagnosed or who had been in the community for a while who didn't know anyone else. Again, building community across the country. These are some examples of people in Colorado, and to the far right, we have Tylee Kraft, who is a young football player at the University of North Carolina, Chapel Hill, suffering with lung cancer. He has been embraced by the community of his university, but also the lung cancer community. In the center here, we have Calvin, who has been fighting lung cancer now for about 3 years. He's doing well. And on the far left here is Corey. Young people here are affected too. Everyone is included. And here was a big event for Tylee. I happened to be in town, and so was Chris, and we came on out and we're part of this really amazing event that day where we had people who didn't even know about lung cancer or what was going on and saw, wow, this is incredible. I want to learn more. And they got involved and took this picture with us and learned a lot of facts about lung cancer. Primarily, anyone could get this disease and no one deserves it. Here are more local like businesses in North Carolina embracing this project. Again, we had this great event with Tylee, such a warm, kind young man, very talented. Chris Draft, such an amazing connector, getting us to be connected to him. And I went out to breakfast with some survivors at the Flying Biscuit. And they were asking about the ribbon. And it turns out some of their employees have been impacted by lung cancer with family members. And the business was very happy to have us there and hang ribbons and take pictures with us.
So we believe awareness is a prerequisite to taking action. And, the two lowest hanging fruit to improve survivorship for people with lung cancer are screening for the disease in those individuals who are eligible. Currently, only 6% of people who are eligible for lung cancer screening receive screening. And therefore, here we are at a conference of primary care physicians, again in North Carolina, promoting lung cancer screening, because it's primary care providers who are mostly responsible for referring patients for screening. So we wanted to make a big effort there to push for screening, but we're also pushing for increased research funding. So for those of us who either have lung cancer or love someone with lung cancer, really we want additional research to keep on working towards improved treatments. Again, here are the national United States cancer screening rates. And as you can see, lung cancer currently is only at 6%. There's about 14 million people who currently qualify.
And this led to the National Lung Cancer Screening Day. The first ever was November 12th, 2022. This was at National Jewish Hospital, but these were occurring throughout the country in different places. We live here in Denver, which is where National Jewish is, and we were asked to come on down and just, get people, talking about lung cancer. And there were 14 people who registered to be screened. And 14 people showed up and 14 people went through the shared decision-making process and got screened. So that's a huge success that, people either didn't know about screening. And so there's been not very much promotion about it. I think next year we're going to work really hard to get more people. But the fact that 100% of the people who signed up actually walked through the procedure, realized that this was not a difficult screen at all. It was very simple. It's like having an X-ray taken. You're just lying down. And we're very, very happy to be part of that. And I don't know what the outcomes were. My hope is that if there were any lung cancers that day detected, that they were all early stage and that people are now treated and living high quality lives. And Chris has been, an amazing connector, but also, has been providing the lung cancer community with incredible opportunities to raise awareness in big forums out of the memory of his beautiful wife, Keisha, who, passed away from lung cancer shortly after they were married. And Chris has been just this amazing advocate, a strong voice for the lung cancer community. And we need to go through with the opportunities that he gives this community, because they are numerous and they are loud and they are very, very visible. And this is what this community needs. So we're always so grateful for Chris's efforts. And here's an example of more. I mean, he rallied people outside of the Today Show on a trip to New York, got some spot coverage there to get people talking. On the far right side here at the City of Hope, he's able to get the people in charge of the administrators and the physicians and the cancer center directors out there to say, yes, lung cancer is important. Let's talk about this. Let's get this out there. And in the center here was the cancer center where I live, where they had no plans for Lung Cancer Awareness Month, and I took action and got the community rallied with the help of Chris and Pierre and our own healthcare providers. And in the middle of the road trip, suddenly they wanted to do something, and we flew back to Colorado to formally present the Cancer Center director with a ribbon. And here they wanted now to take photographs from their media department and post this on their social media. So progress, you know, one step at a time, we're getting there. We're now in 33 countries, all 50 states, and in 5 languages, with more on the way. Sometimes it takes a little while to get these languages out there because the translations aren't always like perfect. So we do go through the International Association for the Study of Lung Cancer, and we wait for them to give us an accurate translation. So we have been making progress. The middle picture and the picture to the far right is Atrium Healthcare in North Carolina. They had a movement in Charlotte where they were getting for Lung Cancer Awareness Month a whiteout, and got some great attention and captured it on film and put it on social media. Far left, I showed this to my cancer center where I had treatment, where I had my radiation treatments at Skyridge. And they were like, well, yeah, we have this projection technology, no harm at all to put this up. We're happy to do it. And now not only do they do it in November, they do it every night of November, but they also do it for lung cancer, World Lung Cancer Day in August. So this past Lung Cancer Awareness Month, again, I had some nice engagement with the people from Skyridge. I asked them, you guys do a really big luncheon for, in general, cancer survivors in June, which the lung cancer community was invited to. They gave me some time to speak, and they had a physician speak as well on behalf of the new advances in lung cancer screening and biopsy tools and so forth. So I asked the director of communications there that day, this was lovely. Would you consider doing a lung cancer survivors breakfast in November? And she was so excited about that. She said, absolutely. So this was the first ever, as far as we know in the country, lung cancer survivor breakfast. It took place on November 2nd. Keith was there and got some great footage and some pictures. And we even had Miss Joni Ryan there, who is Miss Senior Colorado, who has been living with stage 4 lung cancer as well. And this was a great success. We had a nice turnout for our first breakfast. And Linda told me, Linda's the communications director there, she's already working on it now for next October. Next November for Lung Cancer Awareness Month. Here are things you can do if you're wondering. It's been very easy to get proclamations done. And I've seen this happen across the country. It usually starts with an email to your mayor or governor explaining all the facts about lung cancer, which we can get to you, all the statistics about how it's the #1 cancer killer, the least funded, needs awareness, and so forth. And they have been happy to sign proclamations. We also have a lot of radon awareness going on, and that, coupled with lung cancer awareness, usually gets some media attention as well. So articles in newspapers, letters to the editor, as well as sometimes even an actual news piece on your local news.
This is, again, like we said, we also try to promote additional research and more awareness, and we try to get in front of our local and federal legislators. Here we are at the Colorado State Capitol, again, promoting lung cancer awareness and some action steps for radon and radon mitigation.
So this was the state capitol here in Colorado.
Again, I think it's effective for people who are not aware of lung cancer facts to see a little bit about why we're pushing so hard for additional screening, for additional research based on the prevalence of lung cancer in this country and the world and the current mortality rate. It wasn't that long ago, to be honest, where
people who were diagnosed with AIDS or even breast cancer, their mortality rates were exceptionally high as well. So we're a bit following the roadmap that they took in order to improve screening as well as get additional research funding.
And look how far this has gone. I mean, this is in all three pictures you see Dr. Michael Gieske. He is a primary care physician in Kentucky and also the lung cancer screening director at St. Elizabeth's. He has one of the highest screening rates in the country, and he has jumped in with both feet with this. We talked about advocacy to our legislators, and he jumped on board and has been relentless in his pursuits of better outcomes for people with lung cancer. Here he is getting ribbons to our, Mitch McConnell, Rand Paul, and the governor of Kentucky, who recently signed legislation for biomarker testing. These are laws now, and screening, and much more money is going into the development of screening programs and into screening technology. And we were recently in Washington, D.C. The Go-To Foundation hosted the Voices Summit, where they give training on how to approach your legislators, how to ask for the things that are needed. So specific asks in terms of funding amounts and so forth. And this was the first year since the pandemic that this was able to be done live. And it was just amazing to be with everyone and to sit across the table from legislators and know that your voice is being heard. We still have a lot of work to be done. We need more people to, take this on and understand that the people that you approach, you shouldn't be intimidated by them. Certainly respect them, but understand that they work for us. And if they don't hear our voices and our asks, we're not going to get anything. But when we knock on the door and we're, organized in our asks and approach, we can move mountains. We can. I know we can. And here is the big picture Go-To took the other day and put out on their social media in front of the Capitol. My hope is that next year we have more people. But this was amazing for a first time out the door since the pandemic. And on the left, again, we have Dr. Michael Gieske here again, taking this ribbon to the base camp of Mount Everest. The opportunities are limitless. Look at Chris here in Egypt in front of the pyramids with the medical community, researchers. I mean, this is amazing. Before fall of 2020, we weren't getting a whole lot of exposure, and this grassroots organization now and getting people activated just pretty much across the United States and now the world, we can do this. We really can. So here's a little story for you. This is my dear friend Bonnie, and we were brought together by the same diagnosis. We had the same stage 3A diagnosis, inoperable, and treatment plan of chemoradiation, and then a year of immunotherapy. There was one difference between Bonnie and I, and it didn't make a difference. We were sisters. The only difference between us was that Bonnie had a smoking history and I did not. I loved her from the minute I met her on the phone. We were matched through the Go-To's buddy phone system, and we had so much in common. A love for our families. Sadly, Bonnie passed away almost a year ago, May 17th. These are her grandchildren. These are people who loved her. She was quite a personality, and we all miss her. This hurts a lot. We all lose a lot of people in this community, and I find it more fuel for moving forward and fighting on their behalfs and on their families' behalfs and all of the people who are yet to be diagnosed. So I'll keep going. I'll keep hurting, but I'll keep going. So this is kind of how it started. University didn't want to light the building up. I kept seeing them post on social media, They had lit the building up red in September for blood cancer awareness. I've seen them light it up green for liver cancer awareness, blue for colon. And all I asked was that, could you please light the building white for Lung Cancer Awareness Month? The response I got was very humiliating and disrespectful. I was told that there are white lights in parking lots at the university, and therefore that's what they do. I had also asked, could we please tie white ribbons around the trees? And they said that was not permitted. Well, here we go, perseverance 2 years later, 2 asks that were denied, were now permitted. We got this building lit up in November, and we had ribbons tied around trees in front of the cancer center with pictures of people who were in the fight or who had recently passed away. And on the far left, this is my friend Anne. She literally lived a quarter of a mile away from my house. I didn't find her until a year into this diagnosis. She passed in September, and with her husband's permission and with pride, he gave me this picture to put up of her on the tree, and it stayed up the entire month of November. Our people are important. They need to be remembered. And why, again, do I keep doing this? Maybe some of this has to do with survivor's guilt. Here I am with that initial scan that discovered this incidental finding of a tumor in the upper left lobe of my lung. You can't see the lymph nodes here, but they were there. That brought me to stage 3 in the middle of my chest. And here's my most recent CT scan on the right, April 3rd. I'm clear. I owe this community. I want everyone to have a result like this. And Pierre and I will keep going. Research matters. It matters in terms of prevention, to catch these things early and to get the appropriate treatments that are tolerable and allow us to have a quality of life.
Yeah, I mean, just we realize Heidi still has a significant chance of recurrence. So we are pushing always for newer lines of treatments, more clinical trials to become available. And the good news about lung cancer is that there are many, many new medications, many, many new treatment options coming, as well as additional clinical trials, but we need to continue to push.
So a reminder here that the White Ribbon Project is inclusive of everyone. It doesn't matter if you're a survivor or a caregiver or someone who cares about lung cancer. We need people we respect people at any stage of lung cancer, people from stage 1 through stage 4, no matter what type of lung cancer you have, whether it be non-small cell or small cell, whether there's a targetable mutation or not. Everyone's story is so important. I think the problem within the lung cancer community has been people have been reluctant to tell their stories and show their faces. That's not how it worked in AIDS and HIV or breast cancer. Initially, these diseases were very stigmatized. When people started to come out and talk about this and make these human stories, everything changed. Breast cancer has a very high 5-year survival rate now in the 90th percents. And HIV is now considered a long-term chronic condition where people are living normal lifespans. We can do this in lung cancer. We need everyone. Everyone needs to know their story is respected and they are loved as people. People. We are all people. Here are our social media handles. You can find us on Facebook, Twitter, and Instagram, and we do have a website. I think you'll have plenty of opportunity to get some ribbons in North Carolina, but if you know of other people in other places who would like ribbons, go to our website and there is a place to request ribbons there. Does anyone have any questions?
Thank you so much, Heidi and Pierre. That's really beautiful. Yeah, questions? Is there a question?
Yes, my name is Roy, and this is my wife, Chris, and our story is almost exact similar to yours. We've been together since we were 15 years old, 48 years. But I've been having lung screenings for 7 years because they had a small nodule they were keeping an eye on. Well, this past August, I had one, and they said, well, that nodule that you had is actually half the size that it was before. See you next year. Everything looks fine. Well, I was having a screen for something else, a CT scan with contrast. My salivary gland was stopping up. It didn't have anything to do with, they wanted to see what that was. Well, they said it was fine, but they found a lymph node swole up on my clavicle. Well, they wanted me to do a biopsy. Well, I did. So I went straight to the oncologist after that. He said I had 3 months to live without treatment. So I'm wondering if all lung screenings, especially if you were a former smoker, which I'd quit 15 years before, should have contrast. I don't know if that's what caught it or not, but it was hard for me to believe. I had a scan in August and everything looked good. In January, it spread everywhere. I don't know that much about it yet, but that was my question.
Yeah, well, I would say, obviously I'm not an expert in the technologies for lung cancer screening, but there are obviously cases where screening does miss cancer. And that's not only true for lung cancer, it's true for breast cancer, for prostate cancers. So what we're pushing for is additional research, and there is some ongoing research now that's going to combine scans with possibly blood tumor markers. So what you point out is, again, there is still a lot of work to do to improve the prevention, early detection, and treatment of lung cancer. And what we're trying to do is just mobilize as many people who are interested in finding a lane that they want to pursue. So it's a very good question. And clearly your story shows that these tests are not perfect. They're definitely better than doing nothing. We know that lung cancer screening saves lives, but does it miss people? Absolutely. There are false positives and there are false negatives. And that's why we need better screening tests.
Absolutely. Well, Heidi and Pierre, you guys are awesome. I love you. I love what you're doing, and we're like with you 100%. I think I'm going to pass the baton to you guys to introduce our next speaker, right? And Chris, do you want the podium or handheld?
I have a handheld.
Okay. Thank you so much.
Thank you, Dusty, for having us, and we're excited to meet everyone. And I'm so excited for everybody to meet Chris Draft, who is just like I said, the strongest advocate for the lung cancer community, and provides us with so many opportunities to be able to get these stories out. And he is a one-man army and going across the country, across the globe, getting people activated and excited and building ribbons everywhere. I'm just in awe of what he is doing, and I'm so happy that he can be with you today.
Yeah, and again, Chris, former NFL player, so have to understand these are unique individuals, but has leveraged his experience and his talents in another way towards pursuing advocacy. And again, lost his beautiful wife, Keisha, now I think close to 10 years ago, 11, to lung cancer. So Chris, thank you again for being such an inspiration to us and introducing us to the world of advocacy.
Awesome. Thank you, Heidi and Pierre. So while Heidi and Pierre are up here, again, what an opportunity to be able to ask them questions. So I know my guy in the back, you asked a question, but before they jump off, does anybody have any more questions directly for them? I mean, they presented a whole bunch. You got to see the White Ribbon Project all over the place, right? And that was a little gentle nudge in terms of the road trip that I figured that they were going to go see their kids anyway. Their daughter's in Columbus. Their son and his wife lives down here in North Carolina. So, hey, while you guys are taking a drive to see your kids, maybe we stop and meet some survivors along the way. So needless to say, that turned into not just going to Ohio, not just going to North Carolina, but literally basically going across 2/3 of the country. Sometimes it happens that way. Anybody have any questions? Any more questions? Any more questions? Awesome, awesome. So I have some clarifications and things that I just want to add as it relates to that Heidi and Pierre. I mean, again, there was a lot to be able to grab there, but it's a lot because it is. I mean, and really, it's a lot not because of just them. And I think that's the biggest thing, that when you think of the White Ribbon Project, you got to get that this is a community. This is a community that you can want to stand up, as an individual. But that doesn't necessarily mean that people are going to stand with you, right? So there has to be an agreement, right? Just like I have to give props. I'm up here and I got the microphone in my hand. I have got to give props to Miss Dusty Joy Donaldson and Lynn McLeod. All right? I have to do that because these meetings don't just happen. It doesn't just happen. There are people that are committed, that they see that there's a problem. And again, in this community, a lot of times, we see that there's a problem. We think that awareness by itself is the answer. Awareness is just awareness that there's a problem. There's a solution, and then somebody has to act on that solution. Dusty saw that there was a problem. She said that, she saw that we were creating the support groups, but as we were creating more specific support groups, that small cell was an area that needed their own spot, right? And again, just because we have the virtual, and just because we have those things, there's another side to it that says just because they can see that there's a problem, they need all of you guys. And so I want to make sure that you guys look around at each other. Lynn already got you to do it by doing an icebreaker and finding out the books and Vince Flynn books. Just throwing that out there for you guys. That's American Assassin, Vince Flynn. Finding out what food you guys like and what were the other things was. What was it? Food and I know somebody like Rocky Road ice cream. I heard that. What's your favorite song? Katie. Her husband's at home watching virtually, so she was like, my favorite person is my husband, so he felt good at home. But you guys have bought into this, right? Doesn't matter how much commitment that Dusty has, how much love that Lynn has in her heart, if there are not people that are willing to come. So when she put that invitation out, you guys accepted it and decided to get on a plane or drive, because some of y'all from North Carolina. I'm from Cali, but you hear me say y'all. I'm some of y'all from North Carolina, so you're able to drive over. But if you're not willing to do it, you can't have this. The other one I want to give a shout out. There's some amazing people. I know when you guys put a thing up there, it says Amgen, AstraZeneca, and Jazz. And I know Dusty and Lynn, they're going to give all this love to them anyway, but I just want to add to it and say that you got to have your funders. You got to have your supporters again. You can have a great idea, but without the people that are supporting it, it doesn't get done. So a great idea with some funding and people that are willing to take advantage of the opportunity. That's what makes it work. That's that magic, right? So I want to give out some other shout outs. Again, I am a representative of the White Ribbon Project, and you heard, Heidi and Pierre did such an amazing job of explaining it, but I want to give shout outs as I'm here. Is that okay? As a linebacker, I played linebacker in the NFL. I played 12 years in the NFL. Does anybody know what a linebacker is? You guys, can you feel me already and tell that I'm a linebacker? You should be able to, all right? As a linebacker, I'm in the middle, all right? I'm right in the middle, and I'm basically the quarterback of the defense. And as a quarterback of the defense, I'm constantly interacting with my defensive linemen, my other linebackers, my safeties, and, but I'm a little bit different in that I realized that the team was not just the guys that were on my defense. The team wasn't just my offensive guys. The team wasn't just my special teams guys, but it was not just our coaches, but the team was our special team, our trainers and our equipment guys and our ops people, our marketing people, our community relations people, and all of these other amazing folks that really make this game work. So when we talk about an inclusive community is recognizing that all those people are critical. So with that said, if you guys do not know about the Lung Cancer Initiative of North Carolina, I have got to give a shout out to Miss Paige Humble that is in the house. Can you raise your hand, Paige? All right? What an amazing resource. If you guys, just a little bit of history, there was a group called the National Lung Cancer Partnership, and they had a chapter down here in North Carolina, and they felt like that they could do more than just working with a national group, that they could do more for the people here in North Carolina if they established a organization, not just a chapter here, and they stood up and got that done, right? I've been able to see the amazing work grow over and over. You guys have probably seen these lunge walks, you know, they just had one. Was it the last one was just here in Raleigh? Yep, right here in Raleigh. There's one in Charlotte coming up. I think it's May 20th, is that right? Dang, I got a bunch of things in my head. Just trying to give shout outs, man. Just trying to give shout outs. So I have to get that one out. I said I got to get Dusty and Lynn a shout out. Who else am I giving a shout out to while I'm up here? All right. I said, I got to get my guy, Chad. There's this guy, Chad, who works for AstraZeneca. He's in the back. Somehow they gave him an award. LCI, that's Lung Cancer Initiative, they had a gala, and they thought that this guy is just an amazing volunteer. And they were like, shoot, we just got to celebrate him, you know? So, Chad, could you stand up in the back so everybody can see you? Somebody see you. And I'm giving a shout out as I'm going around. The other one, again, Lynn is not just just part of this organizing team, but Lynn, who's already told you that she ropes her family in there, Miss Sinead over here taking pictures, that she can bring her family and friends together, and she's hosted a number of White Ribbon builds, right? So I want to give another shout out to Lynn there, right? If you guys see Jim in the back, he's the guy that's going to start something. He does like Baja fish tacos, okay? But if you guys watch the Lung Cancer Foundation of America, right? This guy has been an amazing leader there. You know, there's another young lady that's usually his partner in crime that's been around with him, but you'll see Jim a lot. But you'll see pictures. You'll see some of the pictures where they're talking about the work they're doing, and you'll see ribbons in those pictures, right? And I'm giving you guys these shout outs because I want you to get this. This white ribbon is a way of connecting people together and reminding, why are we here? Why are we fighting? Are we fighting for an organization, just for a brand, or are we fighting for the people? A lot of times that they say that there's a stigma in lung cancer. They say that. They put it out. They say there's a stigma. But, but they don't always tell you what's the solution to dealing with stigma, right? They say that people don't know. They're ignorant. They say all they know is the connection with smoking, so that's all they know. But there's a solution. If I had a slide, I would put it up there, and I would give it to Keith, because this guy right here, Keith and Travis, I done hung out with these guys a whole bunch. And the slide would be a quote by Dr. Reverend Martin Luther King Jr. And the quote would be this: darkness cannot drive out darkness. Only light can do that. Hate cannot drive out hate. Only love can do that. That's the White Ribbon Project. When people want to know, well, what's the plan look like? The plan is not hard. People have already did it. They said, what do we need to do to change where we are? Well, first, we just need to accept it. We don't like it. That ain't hard. Do we like it? And if we don't like it, then we know we got to do something about it. But the only way we can do something about it is if we're honest. And so when they ask, well, how do I infuse the NFL into the things that I do, is that if we're not honest, what usually happens to us? We get hit real hard. We get embarrassed. And they put it on ESPN. And then they start circling things and they say, what was he doing? What was he thinking? And then now, when I was playing, they didn't have social media. But now they got social media, so now they can Twitterize you and say why did they give this person any money? They're terrible. All right? Because the solution is so obvious, well, especially they call them Monday morning quarterbacks. It's obvious of what to do, but I would say in a lot of cases it is. The key is, are you willing to fix it. Darkness cannot drive out darkness. If we've educated people that getting people to stop smoking is how you deal with lung cancer, if that's all we told them, and not just that we just told them, but we told them in elementary school, if we told them in middle school, if we told them in high school, if we told them in college, after college, on the TV, on the billboard, on the radio, is it a stigma that they know that? Or is that just what we taught them? All right? So when we say, well, why don't they know that research matters? Did we tell them? Did we let them know? Does survivorship actually matter? Well, historically, if the goal is just prevention, really no, because the goal says prevention, getting people to not get it. So if survivorship matters, if our people matter, then we need to say they matter, right? Recognizing that historically it didn't say it. So if we just hang out without being aggressive in saying it, then the default kicks in. You guys feel me? What was said before kicks in unless we say something different. We matter. So I want you guys, if you can roll with me a little bit, can you guys say, I matter? Can you say that? Can you say it like you believe it? Can you say, I matter? Can you look around your table and say, you matter? Can you yell up to me and say, we matter? And then my question is, are you willing to fight to make sure that's a reality? We can say that we matter. There it is. All right, I'm going to go back through it as I want you to get. So what does it look like when we matter? You heard Heidi and Pierre. What does it look like? It looks like when somebody is diagnosed that we meet that person as a person and we let them know that we care about them. We don't act like we're surprised that they don't know anything about cancer, because who goes and looks for cancer information, right? Who does that? Yeah, my hobby is to go to cancer centers and just like ask hella questions and stuff. I mean, who does that? All right, is that all right? You guys feel me on it, right? You're in a space where you just got diagnosed. This is a terrible day, worst day. My wife is diagnosed, worst day. We luckily had a whole bunch of people, medical people around that my wife knew, so we had backup. Not everybody has backup. We need to make sure you all have backup. That's why I'm so excited when I, again, from the Dusty, from the LCI, from that they fighting to make sure you guys have backup. The other part, we do have to max out prevention. We know that. That's real. But we also know that people are still going to be diagnosed. So we have to continue to fight for early detection and continue to evolve in that and get better. We need to make sure we have our incidental nodule clinics. That's why you were even getting screened. We have to make sure the treatments that we have, that people get to them. They get the appropriate care. We have to make sure that people have access to clinical trials, not just that there's clinical trials, but they have access to them, right? So I'm giving you a little bit of this thing because I'm just doing this because of what we have here, and then we're going to go out here and do a little bit of tracing, but I want you to get is that we are going to say that we matter, and we're going to go fight for it. So it's not good enough to just say it. We got to be willing to join in and go get it done. So everybody should know that they matter. We want to make sure that's what fights against stigma. Everyone in here, you guys matter. So can you say it with me? I matter. Can you look around? Can you say you matter? Can you look up here and say we matter? And are you willing to fight for it? Are you willing to fight for it? There it is. There it is. So the White Ribbon Project, that's what it is, right? An inclusive movement that is unbranded, that is flat out about making sure that our people know that they matter and building a system that reflects that, right? Now, I've got a couple of guys I want to say a little something before we do a little tracing, because all of you here, we just talked about the White Ribbon, but you guys are going to get one. right? You're just gonna get a ribbon. Otherwise, we're just talking and then you don't even get a ribbon, all right? Which is some bull. All right, so you're gonna get a ribbon, but you're not gonna just get any ribbon. You're gonna get a ribbon that was made with love by some young people at the University of North Carolina. They led the build, and they actually got some special folks involved in painting and finishing the ribbons up and signing the back of them. So with that, I'm going to introduce my man Varad and Ike from the American Lung Cancer Screening Initiative, and they're going to say a few words about their commitment. Thank you, guys.
Thank you, thank you. I think Chris gives a lot of high praise, but we're really inspired by y'all here and by Chris and Dusty and everyone here, really. So with that, our organization is called American Lung Cancer Screening Initiative, and we're about 200 plus undergrad students and medical students with help from a few advisor doctors, leading a college-led, student-led kind of awareness movement all across the country. So some of the things that we do, we have chapters across different universities, one at University of North Carolina at Chapel Hill, of course, but we talk to senators, we do proclamations with governors and mayors. We also do presentations, and now we've been doing White Ribbon builds along with the White Ribbon Project. And I'm gonna give it to Ike to talk more about what we do at UNC.
First off, I wanted to say it's a pleasure to be in front of y'all. So our work at UNC LC is, what our main focus is just bringing lung cancer awareness to the campus, making sure that everybody knows what's going on, how you can get screened, because it can affect anybody. Anybody with lungs can have lung cancer. So it's important to push to younger people that they, in fact, can have people close to them, close to their age especially, with lung cancer. So some of our past projects have included sending proclamations out to mayors, have included White Ribbon builds and paintings with other clubs and organizations on the campus. And again, our main focus is just bringing awareness to lung cancer screening, and telling people that they're not alone. We do give some of our lung cancer ribbons to patients at the NC Lung Cancer Hospital, Cancer Hospital. But again, it's just a great initiative we see, that all these students we can bring together to push for this. So again, it's just great to see progress.
All right, so wanted to give them a shout out, another one to Michelle Ottersbach back there. You know, you guys heard her. She's been a huge part of the White Ribbon Project. So Varad, Ike, American Lung Cancer Screening Initiative, they have 29 chapters all within here in the United States and in Canada, and they are committed to raising lung cancer awareness, rallying their colleges, their universities. So when you saw that picture that Heidi put at North Carolina, you would have, there was a lot of people, but Varad and Ike were in that group, right? They've been a part of not just, again, their chapter standing up, but really rallying these universities and making sure. And again, most of them don't have a direct connection with lung cancer. So I wanted them to be able to share that so you guys could see. We have college students that are fighting for you right now. They are on it, and they're growing. They're growing these chapters. So again, those ribbons that you guys are going to receive, we're going to do a little bit of tightening up and some painting on some of them. You guys will receive them. They were made here in North Carolina with love. So when you guys go back, again, you'll know North Carolina University students made these ribbons because they care. They could have been doing something else. They could have been partying at a frat house. You know what I mean? They could have been hanging out in the quad. But they intentionally chose to be a part of the chapter, right? So I'm going to give you just a little bit of overview on the process real quick, and then I'm going to jump off because that's where the time is. And so this ribbon process, we said that Ike and Varad were a part of it. Heidi, you guys saw the love. Just Heidi and Pierre on the screen together. You saw that love. So what we say is the first ribbon was made with love. It was made with love. Now, Heidi, she sanitized that thing because she really said, Pierre, make me a big effing white ribbon, right? That's what she said. Now, she's probably on watching. That's what she said, right? But she's nice, so she had to, and then she don't know the crowd, so she can't just say that. But that's what she said. A big effing white ribbon. But Pierre, being the nice guy he is, he just walked in and was like, okay, baby. Made it, put it together, and then their daughter actually made the first label, okay? So there it is. So the first ribbon, again, was made with love, September 27, 2020, and then her daughter sent the label, and that label, October 5th, 2020 is when that label got put on, right? And so that ribbon is what we use. That is our marker that says that we don't just make ribbons, we are making ribbons with love. And so the first part of that process is to take a ribbon that is modeled off of that ribbon and we trace it on the wood. So you'll be able to see that outside. If you guys want to, I want to encourage you guys to be able to do some tracing. You know, we have lunch, but we'll be able to do that in there. And then from that, we trace it on, and then we got to cut it, right? So we trace it thinking about the people. We're thinking about an inclusive community, about people that need to know that they are not alone. And then we cut it, and we recognize when we cut that that's work. It's intentional work. If we want a ribbon, we have to cut a ribbon. But just like if we want something in this community, we got to go fight for it intentionally. After we cut it, we have to sand it because it's not going to be perfect, but we want it to be as close to perfect. So when we sand it, it's a reminder it might be a stack of 32 ribbons, a stack of 16 ribbons, but those are going to go to individual people. So we want you to take time sanding it and realizing that each person matters. We never want you guys to be just numbers. We have to make sure for you to matter, we have to see you for who you are. When we painted white. White is the color of lung cancer. That's our color. But when we think of that, we want to make sure we think of an inclusive community. So it's not just the color that is for the survivors, and not just for the survivors that don't have a smoking history, not just for the survivors that have a smoking history, not just for the late stage survivors, not just for the early stage survivors, not just for the caregivers, and not just for that community, but for the medical community. So when we say inclusive, it says that anybody can receive a ribbon if they want things to get better. So it could be your neighbor that is like, how can I help? It could be Virad's mom, who thought she was just coming and hanging out with him yesterday at North Carolina State. Next thing you know, she got roped into doing some sanding and painting right in front of a Jim Valvano statue. So Virad's mom got a ribbon yesterday. Whoever wants to help this community move forward, we have to let them in. You don't see breast cancer saying, no, no, no. What's your resume? Will we let you in? Will we let you help? All right? No, they see a little girl with a pink ribbon in her hair, and they're like, wow, and they celebrate that. They see Paige's daughter out on a tailgate build at UNC painting ribbons, making a difference in this world. So White, we are together. We have to be together. That's our color. And then you might have a big white ribbon. So when you're going back through the airport and there's this big white ribbon with you, somebody could ask you, why do you have that big white ribbon? Or they can ask you, because there's a label on it, why do you have that big white lung cancer awareness ribbon? And you say, funny, you should ask. So we label it. And then the back, we sign it. So there's going to be some signatures on it. Again, Rod and I, their signatures will be on some of them, but they actually had a group that they worked with that'll have some other people from UNC. But when you get your ribbons, you'll be able to have the rest of the people in here sign them, all right? And you guys will all have a chance to sign them. And again, it says that you are a part of it. So when things aren't going well, or when they are going well, that you can look at that ribbon and know that you are not by yourself. There are people that are going through it at the same time. There are people that are cheering for you, lifting you up. There are people that are fighting every day, right? So that signing is absolutely important, right? And then one of these days, maybe not, because you guys are going to do some tracing. The ribbons, you're going to receive a ribbon, but the ribbons that you trace are going to get to somebody else. So today, as you guys trace, you're going to be making sure that there are people here in this area that know that they're not alone because of your commitment to be a part of the process, right? Does that work? Is that okay? Man, y'all awesome. Miss Dusty, you got it.
Can I just jump in real quick? I'm just showing everybody the original ribbon here. This was one ribbon. That's all we had planned for. And when we saw that people wanted them, it was like, wow, maybe they do feel like me and they're ready to talk. So when you trace those ribbons today, every single ribbon on the planet right now has been traced from this original ribbon. So I just want you to know what you're touching and feeling and signing all stemmed from this one here.
You guys good?
Thank you, Chris. That was fantastic. Thank you, guys. You are awesome. Thank you for making a ribbon. So I do want to ask you to, when you're, trace if you can, but please autograph and sign several ribbons, okay? Because that's going to be going to the people here, and you'll see the process more a little bit when you're out here.